Hi, everyone, and welcome back to the Caregiver Empowerment Program. Thanks for joining me in part two of this webinar, An Introduction to Psychosis, How Can You Help? My name is Alexandra Ferreira, and I'm a senior clinical psychologist with Nua Healthcare. In part two of An Introduction to Psychosis, How Can You Help? We'll be discussing some ways in which you can support individuals who are struggling with schizophrenia or psychotic symptoms. We'll talk about what is important in an evidence-based assessment and the intervention procedures currently used in clinical practice to support managing difficulties, symptoms, and preventing long-term issues. This webinar is suitable for caregivers and family members who are concerned about a loved one who is struggling with schizophrenia. So in this part of the webinar, we will be discussing a series of topics such as how can someone know they have schizophrenia? So someone you care for has schizophrenia, now what? How do I help the person to stay well? And then we'll conclude it all with a summary of all the topics that are addressed throughout this part. So how can someone know they have schizophrenia? In the presence of signs and symptoms of schizophrenia, especially when these are persistent and start to impact on someone's daily life, seeking a formal clinical assessment by a clinical psychologist and or a psychiatrist is highly recommended in order to determine the severity of the symptoms the person is experiencing, as well as to ascertain whether these meet criteria for schizophrenia, for any other psychotic disorder, or in fact, for any other mental health condition, which sometimes can happen. Many people who experience symptoms of schizophrenia are likely to not seek support as they may not be aware of the changes in their mental, emotional, and behavioral states. They're likely to experience emotional distress and be highly impacted in their daily functioning, but might not have the necessary awareness or understanding that what they actually need is to seek medical support. As already mentioned, the main characteristic that describes schizophrenia is the inability to differentiate what is real from what is not real. Nonetheless, in some cases, people may display some awareness regarding the changes in their presentation, and in some of these cases, it is possible that people resort themselves to medical health services and acquire a diagnosis of schizophrenia. Individuals with schizophrenia, more often than not, are referred to mental health services due to the experience of a psychotic episode, which may be accompanied by intense emotional distress and behaviors that may result in harm to themselves or others. As mentioned in part one of this webinar, people with schizophrenia, when they have their first psychotic episode in particular, they really experience intense emotional distress. It's a very frightening and confusing time for them, and they don't really know what to do. So oftentimes, due to that psychotic break or episode, they then access the mental health services through emergency services or admissions to psychiatric units or mental health services. And this is usually where they get their diagnosis. But then again, this would be for people that do not have any awareness whatsoever. Perhaps people that have less severe symptoms might, particularly when experiencing their negative symptoms, they might have access to a GP who might make on a referral to mental health services, and they might get their diagnosis in that way, as opposed to going through the emergency services. But more often than not, people are either accessing mental health services through the emergency services or through referrals by GP due to the encouragement of family members, loved ones, carers, friends, as they notice the differences and changes in the person's presentation. There are several assessment methods used by mental health care professionals in the context of assessing schizophrenia when there are signs and symptoms present. These include validated questionnaires that can be clinician administered, or they can be self-report questionnaires, so answered by the individual. They also include standardized psychological assessment tools, diagnostic interviews with the individual and or their family members, monitoring and record keeping based on the observations made of the person's presentation during the assessment phase, as well as physical examinations. The completion of these assessment procedures aid the mental health professionals in multiple ways. These include determining the severity, intensity, and impacts of the symptoms on the individual. They also help to determine if diagnostic criteria is met for schizophrenia, or if perhaps further assessment is required in order to determine if there might be any other mental health condition or physical health condition that could better explain the person's difficulties and presentation. They specify level of insight that the individual has in their mental health difficulties. They help develop case formulation, which is a theoretically based explanation of the difficulties the person is experiencing, how these developed initially, and what is currently maintaining them. They help the clinician in conjunction with the individual to set therapeutic goals based on what the individual would like to achieve in therapy. And they also help delineate an appropriate treatment and intervention plan to help support the individual in managing their psychotic symptoms. Because, as already mentioned, it is a chronic condition which will remain with the individual throughout their life. Assessment procedures are generally administered before and after interventions so as to monitor the progress of therapeutic intervention or gains. How can someone know they have schizophrenia? So, when we talk about recovery in schizophrenia, there is a definition by the National Institute for Mental Health in England from 2005 that we often resort to. Recovery is what people experience themselves as they become empowered to manage their lives in a manner that allows them to achieve a fulfilling, meaningful life and a contributing positive sense of belonging in their communities. As we said, schizophrenia is chronic and lifelong, which means that there is no cure for it. So, when we talk about recovery in schizophrenia, what we're looking at from a clinical perspective is fewer or stable symptoms, no hospitalizations or the least amount of hospitalizations as possible. As the person goes throughout their life with psychosis or schizophrenia, what they might have is relapses, which are very likely to occur, which means that they might go back into an active episode of psychosis. And that's again where positive symptoms of schizophrenia are very prominent and can be very distressing. These relapses are, in many cases, what result in hospitalization. So, fewer hospitalizations, stable symptoms, or fewer symptoms are what recovery looks like in schizophrenia. Also, someone being able to manage their own funds, finances, and just general daily aspects of living, in the most independent way possible, is also part of the recovery. People often, when they develop schizophrenia, there is a loss of skills, and that could be associated to the cognitive skills that they lose, or just general emotional skills, communication skills, social skills, etc. It really depends from person to person. Helping the person develop skills to be able to manage their life as independently as possible is part of the recovery, so as to not resort too much on external supports. This again will have a lot to do with the severity of the presentation and the person's ability to develop skills that might have been lost throughout the course of the development of the mental illness. And also working or being in school for at least half of the time. As mentioned, cognitive symptoms are quite prominent in people with schizophrenia. So sometimes people lose cognitive abilities that might impact on their ability and performance within the work and academic setting. So again, being able to engage in these activities as much as possible, as much as their cognitive abilities and their overall functioning will allow, is part of the recovery. So, in other words, recovery is helping someone to live a meaningful and fulfilling life to the best of their abilities and in a way where they feel integrated and part of the community and with the least amount of emotional distress caused by their symptoms. So, someone you care for has schizophrenia. Now what? Once formally diagnosed with schizophrenia, there are several treatment options available. One of them is the medical or pharmacological option, which is medication. So, antipsychotic medication is used to diminish positive symptoms of schizophrenia, which, as we mentioned in part one, are the delusional thoughts and hallucinations, as well as to prevent relapses. This is achieved as the medication changes certain chemicals in the brain that affect mood, movement, and the way the person responds to rewards and pleasure. So the medication activates on what we call the dopaminergic system or dopamine system, and it is specifically designed to address the areas that schizophrenia typically impacts from a neurochemical perspective. We have also psychosocial treatment. In light of the vast impact that schizophrenia has on individuals' psychosocial functioning, psychosocial therapies aim to help address these difficulties by supporting the development of relevant skills to cope with symptoms. Some of the most important psychosocial therapies include cognitive behavioral therapy, acceptance and commitment therapy, social skills training, cognitive remediation therapy, family therapy, etc. We'll discuss these a bit more in depth in the slides that follow. But it is important to say as well that psychosocial treatment is not only restricted to psychology. Again, we're talking about relevant skills that the person needs to develop. So if someone does lose skills within the context of their independent living skills, we also have disciplines such as occupational therapy that are a very valuable support in developing relevant skills in the context of independence across multiple domains of someone's life. It is the combination, however, of medication and the psychosocial therapies that promote the best therapeutic outcomes for individuals, and medication is many times crucial to help promote mental and emotional stabilization. In other words, because schizophrenia impacts so heavily on the brain and the brain chemistry, psychosocial interventions are very important because, again, the person is going to learn relevant skills to help them manage the significant changes that they find in their life now in the best way possible. But equally, the medication is highly important because if the changes in the neurochemistry are not targeted and they're not managed, that is how a person with schizophrenia relapses. So even if they have amazing skills, to cope with their psychotic symptoms, these may increase to a point that a person is once again in an active psychotic episode. So the medication is fundamental in schizophrenia to help maintain a stable emotional and mental presentation, and the psychotic symptom management, essentially, which is what the psychosocial therapies aim to support with. They're going to help the person manage their symptoms also to prevent relapse, but in a way to help prevent stress and emotional distress that may come with receiving a diagnosis of schizophrenia and the daily challenges that accompany that. As already mentioned, there is no cure for schizophrenia, and the treatment intervention plans will focus heavily on symptom management. So these will be developed based on a series of relevant factors, such as the level of awareness that the person has regarding their own mental illness and difficulties, the degree of conviction and preoccupation that they have toward their beliefs, so delusional beliefs and hallucinations, and the level of emotional distress that is caused by the psychotic symptoms. When developing an intervention plan, the main focus of the initial support will always be on the symptoms that cause the most emotional distress, which are commonly the positive symptoms, so the delusional thoughts and the hallucinations. And the reason for that is that these are the ones that usually result in the most significant functional impairment, but equally, based on the stress vulnerability model, the more stressed or emotionally distressed a person is, the higher is the risk for mental relapse to occur. And that is why that is the focus of the treatment intervention plans in the initial stages. Once the steps of the intervention have been outlined, several methods can be used to manage psychotic symptoms. One method that we do resort to is what we call stimulus control. So that means identification of specific situations, aspects that trigger distressing hallucinations or thoughts, or intense preoccupation associated to the distressing delusions. So essentially, it is any situation that might trigger a person to have a higher level of delusional thoughts and hallucinations that might start increasing their emotional distress. Supporting the individual in developing and utilizing strategies that will help reduce emotional distress when they are exposed to triggers is also an important part, because even though we might identify them and we might even be able to avoid them or remove them from the person's daily life, it doesn't mean that we're always going to be able to keep them at bay. So there is a time that a person may confront these situations that are triggers, and it's important that the person also develops strategies in order to be able to regulate their emotions and manage that emotional distress they feel at the time. So it also consists in supporting the individual to use sensory-based strategies to reduce the impact of symptoms on their mental and emotional states. These could include noise-canceling headphones that usually help drown out the voices that people are hearing, listening to music, which essentially helps that with that as well. So when it comes to stimulus control, we are trying to manage what stimulates and triggers the person's positive symptoms and emotional distress. In order to do so, there are several strategies that we can use. I mean, in the context of just general emotional well-being and reducing emotional distress, we can resort to grounding strategies, so trying to ground the person to the present moment. It can be an extremely powerful tool for some, and it reduces the focus that they place on their delusional thoughts or on the hallucinations that they're experiencing. People also often benefit from self-soothing techniques, so techniques to help soothe the nervous system, essentially, which helps reduce that emotional distress. Distraction techniques, it could be doing an activity for 20 minutes. It could be watching an episode of a series that they really like. It could be doing an activity such as going for a walk. Any activity that might help distract the mind and divert the focus from the delusional thoughts and hallucinations to something else that is either neutral or more positive. Also, sometimes reassurance from other people, trusted people, can really help someone feel calmer in moments where they're triggered or they're emotionally distressed due to their psychotic symptoms. So, these are just a couple of strategies that can help with general relaxation and reduction of emotional distress. As for the sensory based strategies, this is very helpful because a lot of the times, particularly when experiencing hallucinations, as we said in part one, they do come in through the senses. So, using sensory based strategies to help soothe the senses might lead to a reduction either in the experiences themselves, or it might lead to a reduction in emotional distress associated to those experiences. And ultimately, sensory based strategies really consist in just promoting a safe space for the individual where they themselves feel safe. So we mentioned already some there in the slides, but others could be, for example, putting on white noise or nature sounds, a person humming or singing, dimming lights, or using sunglasses indoors, because some hallucinations, as mentioned, can be visual. So sometimes bright lights can trigger an increase in hallucinations. So having these strategies can reduce the likelihood of those hallucinations emerging or of them increasing in their intensity. Other sensory-based strategies could be grounding with objects in sight. So a person could have a particular object that they look at that makes them feel grounded and makes them feel safe. Fidget toys or textures, so something for someone to touch that might bring calmness and it might be a pleasurable sensation to them. That's also the same for having baths, for example, when people feel very anxious or stressed. Using a weighted blanket, so a blanket that really helps, essentially puts pressure on the body, so it helps as well the person with relaxing. Some people, not everyone, will feel relaxed with a weighted blanket or any other of these strategies, but a weighted blanket can help someone reduce the anxiety by feeling that pressure on their body, and it could make some people feel embraced, comforted, and soothed. So these would be some strategies that would accompany an attempt to try and manage and control stimuli or triggers that might lead to an increase in psychotic symptoms. Another form of intervention would be through cognitive intervention. So, this intervention is usually implemented in relation to the maladaptive beliefs that the individual has in relation to their delusional thoughts and hallucinations. So, beliefs, for example, such as the voices are powerful and the person has to comply with what they say. It is not uncommon for people who experience auditory hallucinations to experience voices of command that command them to do them things. And when this happens, sometimes those commands can be accompanied by threats. So, voices that are threatening if the person does not comply with the command. As you can imagine, this can be highly distressing for a person. So, a lot of the times when we use cognitive interventions, we're really trying to challenge those beliefs and we're trying to help the person see that that is not necessarily the case, they're not necessarily at risk or unsafe if these voices are present. The main goal of this intervention is to weaken the person's convictions in their maladaptive beliefs or delusional beliefs, and that they are rather inferences as opposed to facts. So, not to consider them as absolute truths and that is how the world is. It's really to help them see that this is part of their mental illness and that they can see things in a different way. And it really does help to reduce the strength of the belief and the hallucinations when this is successfully achieved. The individual is supported in testing the validity of these maladaptive beliefs and convictions in their psychotic symptoms by inviting them to not comply with voices or to consider both evidence for and against a delusional belief. So, in the examples given in part one, this would be the case of if someone is in fact fearful that their neighbors might be spying on them and trying to harm them, helping the person walk through, well, what is the evidence for this belief or idea, and what is the evidence that is against it, and really helping them analyze the facts. So that they can maybe realize that this might, in fact, only be something that is developed by their mind and not the actual reality or truth. Also, with hallucinations, as I mentioned, with voices that are commanding in nature, so referring to auditory hallucinations now, sometimes if the individuals do not comply, there are voices that are also very threatening regarding the safety of the individual. So helping the person see through experiential uh, exercises, helping them see that if in fact they don't comply, that the threats they're not real and they won't come to fruition because they are in the context of schizophrenia, they are in the context of hallucinations as part of the person's mental illness. Now, cognitive interventions can only be used when the person has awareness into their mental illness and when the person also has enough skills to actually cope with the emotional distress that comes with having these experiences. It cannot be used for people who don't have awareness or insight. And if we use cognitive interventions with individuals who do not have any insight, we can actually, in turn, exacerbate or worsen their symptoms and feelings of unsafety. So, this is only specifically to people who do have an understanding. So, what if the person doesn't have awareness into their mental illness? In some cases, individuals' convictions in their delusions and hallucinations may remain the same, even when they are taking antipsychotic medication. So the conviction is just too strong. In these cases, any attempts to support the person to consider evidence for or against their beliefs may aggravate their mental state. An alternative form of intervention that we may use in situations like this is referred to as acceptance and commitment therapy, or ACT. As opposed to the previous CBT, cognitive behavioral therapy, ACT is not symptom specific. So, in the previous slide, we referred to actually focusing specifically on the thoughts and beliefs the person has, which are positive symptoms of schizophrenia. ACT is not going to focus on the symptoms, on the beliefs, on the hallucinations. It's Instead, going to focus on the person's relationship with their symptoms while trying to promote a meaningful life in accordance with the individual's values. ACT aims to increase psychological flexibility by helping people to develop relevant skills such as mindfulness, acceptance, linking specific actions to chosen values, etc., that will help reduce negative emotional states and increase overall functioning and well being. So, essentially, it is to help the person the re- reduce the strong relationship that they have with their symptoms, and it's really to take approach of where they just accept that they're there without judging them, without giving them too much importance or power or strength. So this is an approach that has been deemed to be quite helpful and beneficial for some people who do not have awareness into their mental illness. But again, it really does depend on the individual. And there is really no one size fits all therapeutic intervention. And that's why we have multiple to try and support individuals in managing their symptoms. We also have coping skills training. So, the aim of coping skills training is to provide the individual with relevant strategies to manage their symptoms and all of their symptoms, ranging from positive, negative to cognitive symptoms. With the development of these skills, the purpose is to help the person build self confidence in their ability to manage their symptoms effectively. So, if a person is more able to manage their emotional distress, they might feel more empowered to face their psychotic symptoms and see them as in a way that is not so threatening as they would when they're completely overwhelmed with anxiety and fear. Coping strategies developed will vary from person to person, depending on what they need, and also depending on the particular symptoms that they experience. Regardless of the skills developed, the person will be supported in implementing the strategies, rating their effectiveness to see if those are indeed strategies that suit them, that fit them, and practicing them both in their imagination and reality until they feel that they have mastered them. So, the development of coping strategies to help someone learn new skills, but also master them in order for them to practice them in an individual and independent manner and support them in managing their psychotic symptoms in a more effective way. Using relaxation skills to reduce tension, stress, and anxiety is very important because, again, based on the stress vulnerability model, stress is something that will only further exacerbate psychotic symptoms. So, promoting the development of relaxation techniques, anxiety management techniques is very important in order to keep the person as stable as possible. Reducing environmental triggers is important. So sometimes it could just be helping the person go to a calmer environment where there's not so much noise or environmental stimuli going on so that they're not overwhelmed by their surroundings. Engaging in distraction techniques is very good as well because, as I mentioned earlier, by refocusing the attention on something that is neutral or positive, may reduce the impact of a psychotic symptom at the time, and the person will not give it so much attention. Therefore, it might dampen down a bit. Self instruction to reattributing a cause to a particular event. So, people with schizophrenia, let's say in the case of people experiencing paranoia and suspiciousness around people, and feeling fear due to having beliefs that others are going to harm them, sometimes through cognitive therapy, which once again can only be used with people that have awareness. Sometimes people can develop the ability to understand that the way that they might be seeing a situation, the meaning that they might be attributing to a situation, can be changed. And if this is the case, they may be able to manage their psychotic symptoms, so their delusional belief, by actually replacing the meaning and seeing it in a different light, from a different perspective. For example, we can take the case of a person that is walking down the street and they feel like they're being followed by a person who has been walking behind them for 5 minutes now. A person who has delusional thoughts of this nature, that are persecutory nature, they might believe that this person is indeed following them with the goal of harming them. But through the practice of cognitive interventions or cognitive behavioral therapy, we may be able to support the person in understanding, recognizing that they're having a delusional thought that is well normal and part of their experience within the context of schizophrenia. They may be able to stop and say, this is a tendency that my brain has to form these kinds of thoughts. And generally, they result in emotional distress, which is what I'm starting to feel now. So they may be able to take a couple of few breaths, deep breaths in to calm themselves down. And with the practice of cognitive intervention skills, they may be able to think to themselves, maybe this person is not following me. Maybe this person is just going in the same direction as I am going, um, as well as many others, you know. So they might be able to give a more neutral or a more or less harmful interpretation, meaning to the situation, and therefore reduce their anxiety. Increase physical activity by exercising is very important. Increasing social activity by talking to people is very important due to the tendency to withdraw and social isolation when experiencing both positive and negative symptoms. Testing out the beliefs by checking if the facts fit with the beliefs about causes or interpretations of situations. So a bit like the example we use now, which is a very trivial example of someone believing that they're being followed on the street. There are maladaptive coping strategies that people with schizophrenia can resort to, and this is something that we need to change and replace. Some of these may include engaging conversation with hallucinations, so voices that are speaking to them and speaking back to them. By doing so, they're actually giving meaning to the voices, they're giving strength to the voices, and they're actually acknowledging their presence and existence. So that is not a helpful technique. Social isolation is something that people often feel, particularly when they feel unsafe, and they tend to do this, and this is not helpful for the person to help, or shall I say, cope and manage their strategies effectively, their psychotic symptoms effectively. Directing aggression towards self or others may be something that people may do, particularly if they're feeling threatened. And it is a way to ensure their safety and survival. But again, they're basing this off of a belief that is not based on reality, or there is no evidence to support that they need to do that. Using alcohol or drugs to reduce tension. Drugs and alcohol are oftentimes used as emotion regulation strategies for people who are highly anxious or very emotionally distressed, as they often tend to numb those sensations and feelings. However, in schizophrenia, not only does it do that as well, but in the long run, it actually is more detrimental than helpful, because it impacts and affects on those neurochemical elements in the brain that, as a result, drinking alcohol and engaging in drug use can actually enhance psychotic symptoms. So this is very, very maladaptive coping strategy, and it actually will increase the likelihood of a person experiencing more symptoms and more distress. And then not taking prescribed medication, as mentioned before, is a very fundamental treatment aspect in order to manage psychotic symptoms and manage the illness of schizophrenia. Schizophrenia is very complex in its nature, and it impacts on several functional domains, including mental, emotional, cognitive, social, occupational, etc. Therefore, intervention may also include several skills training programs that could be relevant in the context of emerging difficulties. So when we talk about skills training programs, we're talking more than just about emotion regulation skills and development of relaxation skills. We're looking at psychoeducation. Psychoeducation aims to help the person understand their mental illness. So learn about it, what it is, how it presents in themselves, how they currently manage it, how they can manage it in a different way for better outcomes, etc. We have cognitive remediation therapy. This therapeutic intervention has been specifically designed to address the cognitive deficits or difficulties that people may experience when they develop a diagnosis of schizophrenia. As mentioned, people may present with cognitive difficulties that they never presented before. So the aim of cognitive remediation therapy is actually to try and support the people to build up on those cognitive skills and actually return to a point, or as close to as the point that where they were functioning from a cognitive perspective before they developed schizophrenia. So it's to regain those cognitive skills. Social skills training is very important in order to effectively communicate with others, but it also helps the individuals with schizophrenia to effectively identify facial expressions, body language in other people, so as that to increase the likelihood of them accurately interpreting other people's social cues and presentations, and it being less likely for them to perceive them as threatening, particularly for individuals who have persecutory delusions, which again is quite common. Communication skills training is relevant, particularly for those who experience communication difficulties, so disorganized speech or thinking. So people may have difficulties because they might be creating words to express themselves. They might be expressing or communicating in a way where they're using words but not forming, sequential and coherent sentences. They might be jumping from topic to topic, but the topics are unrelated. So communication skills training is really to help them to regain the communication skills that they had before and be able to communicate as effectively as possible based on the severity of their cognitive and communication deficits. Problem solving skills training is very important as well. This would be an important skill to have just merely in the context of people being able to plan and organize their daily life as best as possible and to address emerging obstacles, which are part of life, and help them to see things in a different perspective, as well as build and promote self confidence in their ability to manage difficult situations. This, in turn, will also help reduce stress and anxiety. All these supports can be offered by experienced psychologists. As mentioned previously, the impact of schizophrenia extends beyond the individual and it negatively affects family members, friends, and carers as well. There are several management strategies that, as a loved one, we can implement in order to support individuals with schizophrenia, to strengthen relationships, our relationships with them, and to promote a deeper understanding and cooperation in the management of their psychotic symptoms. So, these strategies include the following: encouraging the person to engage in assessment treatment with specialized mental health professionals. Again, people with schizophrenia may struggle to recognize their need to access mental health services. And when they are actively psychotic and they have already received a diagnosis, they may struggle to recognize that they require more acute supports at that time. So, encouraging them and supporting them through that process of recognition and actually accessing is very important as a carer and a loved one. Support with the promotion of healthy changes in lifestyle that will help with the regulation of the body, which in turn will further help with symptom management and reduction. This can be done by supporting the individual with establishment of healthy sleeping patterns, engaging in daily exercise, and a healthy diet. So, general rule of thumb, everybody functions better when their body is well regulated because this will regulate from a chemical, neurochemical, as well as hormonal perspective. So this is good and applicable for anybody's mental and emotional well-being. However, for people with schizophrenia, as already mentioned in part one, there's a big component there associated with biology and neurochemistry. So by engaging in a healthy lifestyle, keeping this balance of the neurochemistry will certainly help them maintain a more balanced and regulated and stable from a mental and emotional perspective. So, other strategies we can use are to try to remain calm when talking to our loved one, especially if they appear to be experiencing delusional thoughts and or hallucinations. And we need to communicate using a non-judgmental approach. Try to speak to them using simple words and short sentences so as to not overwhelm them. It's important that we try not to overwhelm them because we need to consider that if they're experiencing these psychotic symptoms and they're experiencing emotional distress as a result, they probably are not in a state of mind where they're able to process information, and they're probably feeling anxious, frightened, fearful, threatened, unsafe. So if we do not resort to a non-judgmental approach, we might end up making them feel even more unsafe, threatened, anxious. And the more distressed they feel, the worse the psychotic symptoms are. So we're not really supporting them in bringing a halt to the psychotic symptoms or reducing their frequency, intensity, or the severity of them at that time. So using this approach can really help them by calming down, by recognizing that they have someone there to support them. The supportive approach can really help them in managing their emotions a bit better. They might redirect their focus from what is going on internally for them to the person that is there. And if we communicate in a simple way, we might be able to get through to them, and we might be able to help them to calm themselves down or to engage in their coping strategies, which they may not be able to do alone. Remember that what they report to be experiencing seems real to them, and they may be anxious, fearful, or distressed. It is important to acknowledge that you believe they are experiencing what they are reporting, but not to acknowledge that what they are reporting is real. There is a massive difference between these two. Saying things like, I can see you're upset, that must be horrible for you. This is acknowledging the person's emotional experience, and we're showing the person that we believe, that they are experiencing what they are reporting to experience, but we are talking more about the emotional side of it. We're acknowledging and recognizing that they are distressed. So saying things like what are on the slide, or saying something along the lines of, I can see you're really upset right now, or I can see that you're really struggling right now, but I'm here for you and I'm not going anywhere. This might really help validate the person's emotional difficulties, and it might be enough to help calm them down to the point that we can maybe support them in engaging in strategies. However, if we go and in any way say something that might suggest we acknowledge that what they are experiencing is real, something along the lines of, I believe you, I believe I believe that what your thoughts are telling you are real. Don't worry, I'm going to keep you safe. If things are not clear, and if they are not, if they leave any window open for the person to interpret that what you are saying is actually telling them that what they think is true. So, an example of a delusional thought would be thinking that the CIA is coming to arrest them or to harm them. If you say, I will keep you safe, or I believe that they are coming, or, I believe that your thoughts might be real or that they are real, I believe what you're telling me. These things are vague enough, or sometimes quite directly stating to the person that their thoughts are real. And we are trying to reduce the strength, the power, the control that the thoughts have over the person. So we should never in any situation acknowledge the actual thoughts that they might be real, but just the experience that the person is having, and that we do believe that they're experiencing what they're experiencing. We need to acknowledge that and have them engage with us in a way that we can support them. If the person is not in a calm and noise-free environment, attempt to redirect them to a place where they're less likely to become overwhelmed. So, in the case of a home environment, people might be in the kitchen or the living room. If we start seeing the person becoming a little bit overwhelmed, or they start presenting with symptoms that are psychotic in nature, it's important for us to redirect them to a calmer environment, maybe like the bedroom, and for us to accompany them and to try and support them during that time in order to calm down. If it's in the community setting, so in a place that's overcrowded with a lot of people, it would be important for us to support the person by accompanying them to a less crowded place, or maybe going for a walk in a quiet space, in order for them to be able to calm themselves down and in turn reduce the psychotic symptoms that they may be experiencing at that time. Another strategy is that we avoid challenging the person's beliefs unless this is part of their care plan or intervention plan, and they themselves completed in collaboration with a mental health professional. As mentioned, as part of the psychosocial therapies, cognitive intervention is an intervention we implement to challenge the thoughts and beliefs the person has in order to reduce their strength and reduce the conviction the person has in those thoughts. However, if This is only possible with some people, as we mentioned, and it's based on severity as well as awareness and insight. So, if we attempt to do this with someone who does not have it practiced, who it's not does not have it as part of their plan, who actually is not suitable for that kind of intervention, we can in turn increase their psychotic symptoms, increase their feelings of insecurity, unsafety. They might become insecure in relation to us, and there's a risk of them engaging in behaviors that might be harmful either to themselves or to others, including yourself, a person that they know. Another strategy would be to try to engage your loved one in relaxation or grounding techniques. These include breathing exercises, meditation, etc., or redirect their attention to something non threatening in order to reduce stress and tension. So, once again, it is important for us to try and reduce that emotional distress that they're feeling at that time. And they will have a series of coping strategies that have been tested and trialed with a mental health professional. And these are the ones that they need to practice and master over time so they can reduce that anxiety. But we can help them as well engage in these practices by doing them with them. And they would be rather simple practices to do. Or again, refocus the attention of the person on something else that is either neutral or positive. So they are less focused on the psychotic symptoms, and this will in turn help in reducing the level of distress they are at that time. Another would be encouraging the person to talk about their thoughts and feelings and give them time to take in and process information as well as express themselves. Wherever possible, provide them reassurance regarding their safety and your ongoing support. Also, it is helpful to make plans together with your loved one in an attempt to engage them in a pleasurable or meaningful activity, or it could even be just a distraction activity. But we need to be patient if they do not want to engage at that time. As mentioned, negative symptoms are typically part of the profile of someone who has schizophrenia. So they may be presenting with tendencies to self isolate. They may be demotivated. They may be low in mood, low in energy levels. So for us to be patient with them, but it's important to try and encourage this and to do something jointly to help build on the relationships as well as promote positive experiences. Celebrate the wins, no matter how small these are to the observer's eye. Any changes require a significant amount of effort for someone with schizophrenia, especially if they're experiencing negative symptoms. So we need to help them, provide them praise, celebrate with them when they actually do achieve something that is really helpful in terms of their self-confidence, in terms of building or further growing, enhancing, deepening the relationship that they have with you. But equally, we need to recognize that they're not always going to be capable to engage in activities or engage in simple tasks and goals that have been set out either in collaboration with their mental health professional or with yourself, for example, household tasks. Help create a low stress environment by having a regular routine in place to ensure organization, order, and consistency. And do not neglect your own self care. Give yourself the time to relax and engage in pleasurable activities regularly. Also important to engage socially with other people, to have a social network to support you with your own difficult emotions. As we saw in part one of this webinar, the impacts of schizophrenia are not only restricted to the individual, but they also pass on to family members, caregivers, friends, loved ones in general. So we saw that the consequences of that could be very detrimental to both the physical and mental health of people surrounding the individual. And it is important that self care is a big part of a carer's focus when they're supporting a loved one or anybody who is struggling with schizophrenia. And if you are well and you are keeping yourself well and mentally and emotionally stable, if you're taking care of yourself appropriately, the better you'll be able to support your loved one who is struggling with psychosis. So, how do I help the person to stay well? Unfortunately, it is possible for a person with schizophrenia to have relapses several times throughout the course of their life. depending on, again, symptom severity, their response to medical treatment, and the implementation of effective management strategies. Relapses occur, and this is perfectly natural in the journey to recovery in individuals with schizophrenia. People with this diagnosis and their carers should not be discouraged when a relapse does occur. We need to normalize this as part of the journey in overcoming the difficulties associated with it. And we need to acknowledge that a relapse is likely to occur, but a person can overcome it, as well as loved ones and supporters. A relapse in schizophrenia occurs when an individual experiences the re-emergence or worsening of psychotic symptoms at any point in their life. And as we said, stress, anxiety, difficult emotions can lead to a rise in psychotic symptoms. So it could be the case that a person that has been mentally stable for years, they might experience a significant loss in their life, and that might be enough to lead and result into a psychotic episode, so a relapse. Part of relapse prevention consists in teaching the individual to expect relapses. So normalize them. It is very important. Know what their early warning relapse signs look like. Be wary of what kind of situations may trigger their relapses, and develop a plan on how to deal with those signs and symptoms when they do emerge. So we know that we can't prepare for every single situation, such as the one I just said in my example of losing a loved one. But there might be certain stressful events in life, like, certain people might struggle when there's Christmas because there's a lot of commotion and a lot happening. They might struggle with certain times of the year in their professional work because certain times of the year might lead to higher needs in the company and they'll have to perform more. So there are certain situations that might be triggers and that we can help prevent or prepare for, but there are others that we cannot. So again, normalizing the experience of relapse in schizophrenia is crucial. There would be early warning signs in any individual with schizophrenia. Those signs are not a sign of relapse. Those signs are the signs that start to come up and that can either stay around for a while or they can just be there for a couple of days and a person is in full blown relapse shortly after. But those signs are very important to know and to have noted down in a plan, because those are the signs where the person can still do something with the support of others, or either resorting to mental health professionals. They can still do something to prevent the relapse from occurring with more intensive support at that time. And the plan as well needs to include how the person will be able to manage those signs and symptoms when they do reemerge. So if a person does relapse, having a plan in place on how they can cope is going to be very important. And this again is typically done with a mental health professional. This plan could involve just increasing supports in the family home, in the workplace. It might even be taking time off work during that time, or other times, again, depending on the severity, depending on the awareness, depending on the person's presentation, a relapse might be always accompanied by the need to be hospitalized. So it really does depend. But the plan always contains the steps necessary for the person to be able to manage that as best as possible, or get the right supports to manage the episode as best as possible and recover as best and as fast as possible. As a carer and or family member, there are things that you can do to support the individual in preventing these relapses and staying mentally and emotionally well when early warning signs do start popping up. So have a clear understanding of what your loved one's early signs are. Encourage them to review these regularly, so monitor them themselves and keep them listed in a place that is visible for all family members, friends, and carers, so that when they do emerge, they're very easy to identify and everyone is able to spot this is an early warning sign. Encourage the individual to engage with relevant services and professionals on a regular basis, but especially when early warning signs start to emerge. Normalize relapses in schizophrenia and remind the individual that even though they happen, it is easier to overcome the difficulties after having engaged in treatment and intervention. Encourage the individual to continue taking the medication as prescribed. This is fundamental, again, from a neurochemical perspective. Encourage the individual to monitor their mental state daily and keep track of any dips in their mood and changes in their psychotic symptoms. So, the presence, the re-emergence, the worsening of the psychotic symptoms, possible causes that may be contributing to that at the time, so possible triggers, as well as the intensity and frequency of these symptoms. Monitoring will definitely help the person understand if they're getting worse and in time so that early intervention can be facilitated to prevent a full-blown relapse. Encourage the individual to manage their psychotic symptoms by identifying triggers and making a plan on how to avoid or manage these triggers in their environment. So, things to do before, during, and after a trigger has presented itself so as to reduce emotional impact and stress, which is generally the catalyst to psychotic symptoms worsening. Encourage and support the individual in identifying adaptive coping strategies that help in reducing or managing stress and engaging them in daily strategies to prevent mental deterioration. As we've spoken, stress can definitely lead to an increase and rise in the psychotic symptoms. So, stress management is one of the fundamental components in recovery and management and mental and emotional well being for people with schizophrenia. So, having people know what their strategies are, strategies that they've learned and they've practiced and mastered, have them engage in them at appropriate times is very important to help the person stay well. Encourage the individual to continue to engage in daily healthy habits that help with psychophysiological regulation. So, again, regulation of the body and regulation of the mind and neurochemistry, such as regular sleeping pattern, exercise, and healthy diet. And be compassionate toward your loved one and their difficulties and encourage them to focus on the gains. Again, this is a very difficult journey. So, being supportive and being there for them and helping them recognize just how far they've come, from when it all started can really be helpful to people that are struggling with schizophrenia. So again, we need to be vigilant of the person's early warning signs, and this is crucial in the context of relapse prevention, as these are indicative of mental health deterioration. Despite the person maybe not appearing to be mentally unwell, they might still seem fine, but the signs are starting to emerge, and they themselves might not be able to identify them. So, as a carer, we have a crucial role in identifying early warning relapse signs. The signs usually represent a significant change in the person's presentation or behavior, and they may include the following: worrisome drop in performance in daily activities. So, a drop in their performance at work, at home, self care, personal hygiene, etc. Increased difficulty in thinking clearly or concentrating, without this being associated with apparent fatigue or tiredness or lack of sleep. Suspiciousness, paranoia, or uneasiness around others. These are just a couple of examples of signs that could be indicative of mental health relapse. However, there are many other signs, and typically these are very unique to each individual based on their unique presentation. We have a few more, which include difficulty discriminating what is real from what is not real. So the main underlying characteristic of psychosis and schizophrenia. So if we start seeing that, we know very well that we might be looking at a relapse soon. Confused speech or difficulties in communicating with others. Observed talking to themselves or appears to be listening to something that you and other people around cannot hear. Losing interest in personal appearance and life in general. Desire to spend more time alone than usual. Strange feelings or displaying not feeling anything at all. Increased restlessness, irritability, or anxiety. Having unusual and overly intense new ideas. And signs of aggression towards self or others. In the third-party link section of your learning management system for this webinar, you will find guidance on additional services in the community where you can seek out additional information and support in relation to psychotic illnesses, including and specifically to schizophrenia. So in summary, today we went through some helpful information about psychosis, specifically schizophrenia. We also talked about the difficulties experienced by individuals with schizophrenia and the impacts of this mental illness on their overall functioning, as well as the people around them, how we can support them as caregivers, and where we can seek support in the community if it is required. Compared to before we started a couple of hours ago, you should now have a greater understanding of the following. You should have an overview on psychotic disorders and schizophrenia in particular, how schizophrenia presents in individuals, even though it is unique to each person, the development and course of schizophrenia, the impacts of schizophrenia on daily psychosocial functioning, where to seek help for an individual who's presenting with psychotic symptoms, how to support and ensure the well-being of a loved one who has a diagnosis of schizophrenia, and lastly, what are the available supports in the community? I'd like to thank you all for your time and attention during today's webinar. We do hope you found it helpful. Should you wish to add structure to your caregiver routine, please refer to the sample tools and third-party resources associated with this webinar, which can be found in your learner area of the learning management system. Please keep in mind that these are only samples, and with your newly acquired knowledge, you may choose to use these tools in whole or in part. And research alternatives, resources, and tools have also been made available. If you have questions in relation to any of the topics or areas that have been raised during today's webinar, please feel free to contact our team by emailing clinicaldepartment@nuahealthcare.ie. Thanks again for joining me today, and I do hope to see you in the next webinar.